with Georganne Chapin, Executive Director of Intact America, which opposes circumcising any child, male or female, before they can give consent. Welcome.
Thank you so much. Thank you for having me on your program. I really appreciate it.
Sure. Can you tell us a little bit about yourself?
Sure. First, let me tell you how I got involved with the issue of circumcision. When I was 10 years old and knew nothing about sex or penises, I had only sister and mother and grandmother, and I had a baby brother, and I witnessed a terrible outcome from his circumcision. And in my family, we had to deal with that, my mother particularly. And I saw the agony that created. And even though I didn't have any facts really about it, it stayed in my mind as something that kind of like, why would we have to do surgery on a newborn baby was really kind of my thinking at the time. And then I really just didn't get mentioned or thought about. And later, when I was a graduate student in anthropology and public health, and the female genital mutilation conversation started coming out, I began asking people, well, why do we condemn that when we do that to our little boys? And there's, of course, a lot of pushback. People continue to insist that it's somehow different to cut a boy than to cut a girl. And I always disagreed with that. And then when my son was born in 1980, my husband and I never even considered circumcising him. We knew it wasn't necessary. And why would we inflict that on him? Later on, I became a healthcare executive. I had a long career in healthcare. And when I was 47, which is in the late 90s, I went to law school. And around the same time, just really coincidentally, serendipity, my son thanked me one day. We were on a road trip, and he said, I never thanked you, Mom, for not letting them circumcise me. And even though I was totally comfortable and used to, I thought what I thought and believed what I believed, it was the first time I ever thought of circumcision as something with a lifelong impact, that you would have deprived. He was obviously enjoying his natural self, and that I would have even considered depriving him of a body part that had a lifelong function. So that's really when I started moving from just kind of saying, oh, it's silly, it's ridiculous, not necessary. That's when it kind of coalesced with my earlier observations that this was something really not just traumatic to do to a baby, but something that really would last a lifetime, the negative consequences or the positive consequences of keeping your own body. So when I was in law school, I wrote a paper for a bioethics class about circumcision and kind of made everything come together, and that and my son thanking me and my career in healthcare and becoming a lawyer, I just became an activist, an intactivist, as we call ourselves. And got involved with a group of people who had been fighting circumcision for a number of years, for decades. And in 2008, with a private donation and the collaboration of this group of people, we formed Intact America. And Intact America is by far now, I can't believe, 13, 14 years old, by far the largest anti-circumcision organization. We have a very small but mighty paid staff and some very serious volunteers and tens of thousands of followers on our website and Facebook page, and many, many, many more who get involved on Twitter and Facebook. So we're a large organization with a large following and a growing image of as a human rights organization. And of course, the right that we're talking about is the right of every person to keep the body that nature or God or whatever your belief system is, but we know nature gave them.
And I will say that I 100% agree with your stance on this topic. Although
that's a relief.
Yes,
thank you.
I will say though, I had 2 girls and a boy. And I will say that if I had a boy first, he probably would have been circumcised, because at that time I had no idea. I thought it was just something that you just do and that you have to do. And it was just like this automatic thing that you do. I didn't know, for example, that most of the world actually doesn't circumcise babies routinely. So can you tell us a little bit about that? Like why, who tends to circumcise? I know in the US it was routine and still routine in a lot of areas. But why do we do it so routinely in the US when the rest of the world tends not to? I did when my kids were young and I ended up researching it. I did read it had something to do with, and you can correct me if this is completely off base, the Kellogg family, like as in cereal Kellogg.
Yeah, it grew out of the Victorian. It started in the Victorian era, which was the middle of the second half of the 19th century. So, the 1870s, 1880s, before the germ theory of disease had taken hold. And before we knew, really, before Western doctors knew what caused so many conditions and diseases. And there was a tremendous amount of sexual repression at that time. And boys masturbated as men and women have throughout history. And that was seen as something dangerous and threatening to the social order and threatening to the male's life. The spilling of sperm was thought to put him in a weakened state. And Kellogg's were just, part of that mindset, the kind of Victorian American culture. And there's actually a movie called The Road to Wellville that was about a resort that was in Michigan that was owned by the Kellogg family. So John Harvey Kellogg has kind of gained this outsized reputation for starting circumcision, but it was Victorian doctors who in England and America. So you're right, America's the only country, United States, the only country that routinely circumcises baby boys anymore. But in that era, it started as a custom in the English-speaking world. So England, Canada, United States, Australia, New Zealand, all began circumcising boys. Started with teenagers as a way to discourage them from masturbating. And then as obstetrics became a specialty and childbirth moved from being a woman-centered activity with midwives, home births, natural doulas. I know you're a professional doula, but women have played that role throughout human history, facilitating the process of childbirth. And as it moved, as medical specialties grew and obstetrics became a surgical specialty and childbirth moved into hospitals, doctors started circumcising baby boys, newborn baby boys. It's a lot easier to cut off the foreskin of a 2-day-old baby or a 1-day-old baby than it is to catch a 14-year-old and tie him down and cut off part of his penis, the part that he enjoys. So that's how it evolved. And through the first half of starting in the 20s and 30s, when childbirth started taking place more routinely in hospitals, became very common. The obstetrician was the one who did it. And interestingly, being circumcised was kind of a status symbol at that time because it meant that the mother had the resources, the money to have her baby delivered in a hospital. Of course, we all know what that entailed. It entailed drugging the mother, wrapping her up in, in gowns. And it wasn't a safe or more healthy alternative, but it did take hold. Then around by the 40s, really, circumcision became fairly routine, but then it diverged because England developed the National Health Service, and there was a lot of controversy there was a lot of facts about circumcision, that it wasn't necessary. And they said, well, if it's not necessary, we're not going to pay for it. The US had a privatized medical system, and circumcision was a fee that could be charged to the parents or later the insurance companies. So that's really how it took hold in the US. And then, over the rest of the 20th century, it became firmly ensconced in American medicine. And in some places in Canada, while England left it aside, Australia dropped it also in the latter part of the 20th century. New Zealand dropped it around 1970. it just became an American custom. And then we taught the North Korean, sorry. And then we taught the South Koreans to do it during the Korean War. Anywhere where American military medicine took hold, we tried to get them to adopt a culture of circumcising babies. And South Korea still has a fairly prominent circumcision practice, although I'm not sure. I think it might be on the decline, but I'm not sure about that. So the US remains the only Western country that, for non-religious reasons, circumcises boys. And of course, in the Muslim world and in Israel, circumcision is a routine practice, but it's not a medical practice. They don't consider it for medical reasons. It's considered a religious custom. But even certainly in Israel, there are a growing number of intact boys and families who are keeping their children intact and practicing, even if they're observant, instead of practicing the bris with cutting, they practice something called brit shalom, which is a peaceful, welcoming ceremony without the cutting. And lots of American Jews do that, and Jews around the world. So it's not by any means universal among Jews. And I know less about Muslims, but I do know Muslim men who are opposed to circumcision and who are not circumcising their sons. So it is on the decline, although still very prominent in the US.
Has it declined at all in the US?
We think so. We know from the height of circumcision, probably the heyday of circumcision was in the 1970s in the US. And the statistics are terrible, but it's safe to say that at that time, 90% of American men, 85 to 90% of American boys were being cut, which translates into probably 75% of adult American men today are missing a part of their body that was stolen from them when they were a couple of days old. And the implications of that for our culture are really astonishing, that most men walking around today in the US, with the exception of immigrants from countries that don't circumcise, most men are missing that body part, and their partners have similarly not ever seen an intact male penis. So it's really a very the impact on our culture of having most of the males minus their natural foreskins is quite devastating. We think the rate now is, we don't know. I mean, I've seen official statistics of upwards of 55%. It seems still very, very prevalent in the Midwest and some other parts of the country, and less prevalent on the coasts. But it varies. It even varies within cities. Depending on, some hospitals are big circumcising hospitals, and some are less so. Of course, it's still a fee-for-service medical procedure. So we know that women who give birth in American hospitals are heavily lobbied to cut their babies. Intact America does surveys on various circumcision-related topics, and we did a survey in a couple of years ago. It's 2022. I don't want to get the date wrong. It's on our website, intactamerica.org, the results. And we found that that 94% of women who had given birth in the period that we were asking about, it was the last 3 years, I believe, had been pressured to circumcise their son, had been asked, and some of them numerous times, and some of them described it as coercion. So that shows you how prevalent the selling of circumcision is. And the average number of asks was 8 times. We also asked the question, if you had not been asked, would you have circumcised your son? And upwards of 40% of women said yes. So it's still, as you said, probably something that too many women see as a default. But the number of people in our survey who circumcised their sons was way higher than that, due to the asking. Had they not been asked, they would have not done it. And because they were asked and pressured, far more agreed to circumcise their sons. And of course, we hear from thousands and thousands and thousands of women who consider themselves regret parents, regret moms. You know, they feel they were railroaded into it and they didn't have enough facts, and also often in a state of, you know, postpartum exhaustion, sometimes under the influence of drugs. Yeah. And somebody slaps a consent form on a clipboard in front of you, and just want to go back to sleep or be a good patient.
Right. And I think a lot of times the risks are downplayed as well.
Tremendously downplayed.
Like,
in fact,
no
it comes to outright lying a lot of the times. You know, not going to hurt. Only takes a second. You won't feel a thing. He'll be fine. It's better. There's no difference. This way you can keep him clean. I mean, who doesn't want to keep their baby clean? But what's neglected to mention is you're sending a baby home with an open wound and a diaper that's going to be filled with urine and feces. And, you know, there's nothing clean about circumcising baby. Infection risk and healing, and not to mention the impact on his sexual pleasure. And that's, you know, that's an uneventful circumcision. You know, we know there are lots of complications.
Yes. And I like your point that sometimes it depends on where you're located too. So I'm located right outside of Boston, and I do feel like I've been working in the hospital system for almost 10 years now. And I do feel like there has been a shift, at least in the hospital that I worked at when I first started, to now, where I remember a couple months ago, I was in a room and the family was asking to have the baby circumcised. And the OB said like 4 times, this is not medically necessary. If you are choosing to do this, it is not for a medical reason. And then she would say, do you still want to do this? And they would say, yes. And then she would say it again. Like she said it like 4 times, almost like she was trying to talk them out of it.
Right. Sure.
And there are some providers at the hospital now who won't do them at all. So they have to like have someone else do it. And I've seen like pediatricians say, like, ask the nurse, is this family going to get the baby circumcised? And the nurse will say no. And the pediatrician will be like, oh, good. You know, so I think at least in my area, there has been a shift over the last 10 years where
that's
pushing it.
Yeah, that's wonderful. And you just wish that every mom having a baby could be in an environment where they're told the truth. Starting with it's not medically necessary. Of course, it's much more powerful to say this harmed your baby. Right. This is taking away a body part that belongs to him and that has function and brings pleasure. So that would be the next step for the doctors to say, you know, it does hurt and it is risky. Most doctors are not quite there yet, but that's wonderful. You must feel relieved when you're in that environment and you hear that.
Yeah. I do still see some untruths, like a lot of times I'll be in the nursery and often I walk out because I can't stand to be in the room when they're doing the actual procedure, but I can hear the baby screaming and the nurse will bring the baby back to the room and say, oh, he slept through the whole thing. And that's not true. It's not true. The baby did not sleep. And I know they're probably saying that to make the parents feel better, but you're lying to the parents. And if the baby didn't cry, it's probably because they just completely shut down from pain.
I know when I hear that too, I work, you know, in a hospital and the babies just sleep through it. I think, where have you put your brain to believe that, you know, that you can rip? It'd be like saying the baby slept through getting his fingernails ripped out. You know, this is an extremely traumatic procedure. And even if anesthetic is used, which for decades, nothing was used, right? The baby was just immobilized. Even if anesthetic is used, a penile block, you know, injecting painkiller into the base of the penis, 3 injections. I mean, think about what that feels like in your mouth if you're going to get a filling or something. And then topical anesthetic is not effective at all. So how anybody can deny the pain that it causes is, you know. So, you know, there's a lot of information on the intactamerica.org website. And we have a fantastic Facebook page where we post Friday foreskin facts, and a Monday Ask Marilyn. Marilyn Milos is a registered nurse who was the founder of the anti-circumcision, the intactivist movement. we do, that's Monday column that comes out on Facebook. And then on our website, we have not only lots of information for new parents and babies, but we have a section called Voices, which is parents, adults speaking out about their own circumcision status experience, or their experience as as an older person who was decided not to circumcise, as a parent who decided not to circumcise. There's just a lot of personal stories, not being very articulate, but the Voices series on the Intact America website is something that any parent who's considering circumcising his or their child should look at, because those are the stories of people with experience.
Yeah, and I was looking on your Instagram as well, and the Intact America Instagram, and that's on there too. Which
yes,
I was totally. I'm like, it's such a great page, so much information. Yeah,
thank you. Yeah. Thank you for mentioning that. Yeah, IntactAmerica.org is we're actually doing a revamp of the site, and we are unequivocally opposed to taking the body part off of a child. And we also talk about a couple of other things. We talk about consent, even the kind of consent that a teenager or an adult can give is often uninformed consent, because doctors don't tell the whole story. They don't tell the truth. So to say, well, let him wait till he's 18 and then he can decide. We have lots of stories of 18, 20, 22-year-olds who were told the same garbage, really, by doctors who wanted to cut them. It's fine. You won't notice any difference. Well, if you won't notice any difference, why are you doing it? It's better. You're going to have to do the other common. It's going to have to be done at some point. So you might as well do it now. And that's given as an excuse to parents. Like, no, it's not going to have to be done at some point. In Scandinavia, where circumcision rates are, way below 5%, probably 1% were newborn circumcision rates. No, in nearly 100% of adults in the country are not circumcised. They didn't have a medical problem requiring circumcision. And most medical problems, the rare medical problems that foreskin could present, have other less invasive treatments. So we don't cut off women's labia because they have a blister, right? Or an infection. We don't. So we don't cut off women's genitals because they get urinary tract infections. Girls get more urinary tract infections than boys do, and they can be treated with simple antibiotics. About 50 cents worth of antibiotics will cure a urinary tract infection. So all of the pathologies that are presented as justification for circumcision are not justifications for circumcision.
Right. Because I know there's a lot of talk of like circumcision reduces the risk of STDs, which I don't think is even true.
No, there's no proof. The data that are cited now, and they're starting to say this less, because there's absolutely no proof, based on these very unethical studies conducted in sub-Saharan Africa among mostly marginally literate or illiterate adult men who were essentially coerced into giving up their foreskins with the rationale that they wouldn't get HIV from women, because they aren't proving any reduction in transmission from men to women. So men will have their foreskins removed, and terrible consequences done. This is done kind of assembly line style. They're often given food and money, supposedly for transportation or whatever, and there they are, cut loose onto back in the world with this illusion that they're not going to get HIV because they're circumcised. And it's a travesty. So in Western countries where research has been done on sexually transmitted diseases, including HIV, there's absolutely no evidence to support the claim that circumcision reduces transmission of sexually transmitted infections, which doesn't.
Right.
The military has done studies. There are lots of studies coming out. But this is the history of circumcision in the US, is that there are these bogus claims. Don't forget, it'll stop masturbation. It'll cure tuberculosis. It'll prevent mental illness. Yeah, these were all 19th century claims, things we didn't know. Insanity, fecal and urinary incontinence, circumcision will just fix him right up. He won't have any of those problems. Those were blatant untruths and lies. And then, and then cleanliness. Well, again, who wants to have a dirty baby or a dirty penis, right? Nobody stops to think that you can teach your child, to read, to do math, woodworking, and send your child to college or not, or to vocational school, and your child can become a master carpenter or a physicist or a software developer, and you can't learn to wash his genitals.
Right.
I mean, it's so absurd.
You just teach them. Yep.
Yeah, you teach them the same
way.
Like
you teach them to brush the teeth.
Right, exactly. Right. Brushing your teeth probably feels a lot less pleasurable than washing your penis in the shower. And there's nothing inherently dirty about the human genitals. I mean, this is throughout. Again, you don't need to be obsessed about cleaning your genitals. Just regular old bathing is just fine. That's true. Yeah. Taking care of an intact boy is far easier than taking care of a newly circumcised boy. And the foreskin does not detach from the head of the penis until the boy is older, and sometimes as old as late teens. So that's the other thing that you allow me to talk about is boys who are kept intact don't stop being potential prey victims of a medical system that loathes the foreskin. So we get reports every day from parents who've taken their child to the doctor or to the emergency room, their intact child, and had the doctor or nurse grab that child's penis and force back the foreskin, which is breaking the adhesion to the glans penis, to the head of the penis, creating immense pain, bleeding, subsequent possibility of infection, terrible trauma. Actually, a story came out the day we're recording this. Can I mention that? We're recording this on April 27th, right? Like a story came out today or yesterday in a paper in the Midwest, North Dakota, about a mom whose child was forcibly retracted in the emergency room with the excuse that he needed a catheter, and you don't need to forcibly retract a child to put in a catheter. And this story repeated probably thousands of times a week around the US. Doctors and nurses, despite the fact the American Academy of Pediatrics says a male's foreskin should never be forcibly retracted. It will retract on its own when it's time. Despite the fact that the AAP says that, doctors and nurses insist that this is necessary. And they tell parents they should be doing it. And that creates terrible harm. And it doesn't end, it doesn't end with keeping your son intact. That's something that's really important for people to know, that they're going to have to fight off the circumcision culture. And it doesn't end with adulthood. Men who might have a minor problem or no problem at all we have a story coming out soon from a young man. He's not young anymore. When he was 18, he went for his college physical, and the doctor told him same thing, you might as well get that taken care of right now. You're going to have it cut off anyway, eventually. So you might as well do it now before you go to college. And he realized immediately, he did. And he said it was against his better judgment, but he went along with the doctor and realized immediately that he had lost sensation a lot.
Yeah. I would say that was for me the biggest challenge of keeping my son intact was I was really surprised at the pushback I received, because I homeschooled, I had home births, and I got a little bit of pushback for those things. But when I said that I wasn't going to circumcise, it was much more of a pushback, which surprised me, because in my head too, I was thinking like, why is my son's penis any of your business anyway? But I had like the most ridiculous things thrown at me, like, oh, no girl's ever going to want to have sex with him because he's going to smell so bad and he's going to get STDs. And it's just, it was, even back then when I just didn't know that much, I still knew that those were ridiculous statements. And then making sure that every time I brought him to the doctor, that they weren't going to pull back on his foreskin.
Right.
Every time I left him with someone to watch him, that they knew 100% that they are not to pull back on the foreskin, because none of my family and friends had ever cared for an intact baby. So,
right. And they thought there was something, they thought there was something they had to do, right? Instead of just leave the child alone, right?
Right. And I know a lot of when this topic is brought up in like Facebook groups, there's a lot of people, especially people who work in assisted living with elderly, who are like, well, you should see what issues they have now and it smells bad. But that's also the time where a lot of foreskin was probably being pulled back. Right.
Well, not only that, but what do they do to take care of women? I mean, women's genitals excrete smegma also. And I'm pretty sure there are way more old ladies in these nursing homes than there are old men. And what are they doing? Have you ever had anybody say that's a reason to shave off, all the outer genitalia from women? I mean, you wash, somebody just has to be washed, right?
Right. And I did say that at one point to someone. I said, if you are responsible for bathing this person and you're saying that this person's penis smells all the time, who is to blame here? If they can't blame themselves, if they can't bathe themselves and you are bathing them, obviously you're not doing your job properly. If there's still smell, after.
Right. Well, the other thing is, since we're talking about smelling, and like, this person has lived with his foreskin for 80 years, 90 years, and presumably has gotten plenty of pleasure and use out of it, and it never caused him any trouble. So why are we using this as an excuse to cut a baby boy's penis, right? I mean, if just the same way we plan for our own old age, or we should be planning for our own old age, maybe we move into a one-story house or something. If a man is really, who loves his foreskin and his body and feels good about himself, feels that this is going to be a big problem for people, he can still decide to have circumcision, right? I mean, you don't have to cut a non-consenting child. Why don't we just remove the breasts of all girls? Because we have American women have a 1 in 8 chance of developing breast cancer sometime over our lifetime. That's an astonishing statistic. Males have a 1 in 100,000 chance of developing penile cancer. 1 in 100,000, and it can occur in circumcised boys as well as intact boys, circumcised men, usually old men. So 1 in 100,000, and we're talking about cutting off 100% of foreskins, and 1 in 8 for breast cancer. And we would be appalled at the idea of prophylactically removing the breast buds of every girl, but it would make her chances of getting breast cancer nil.
Right.
So, and then that's somehow a ridiculous comparison. Well, is it? I mean, you have one penis, it's a functional body part. Why is that? Or you say, well, why don't we cut off people's fingers? Why don't we cut off, take out people's fingernails so they won't get fungus under it? Oh, that's ridiculous. Well, is it? Why is that more ridiculous than cutting off a part of somebody's penis?
I'm so glad you said that, because that is the exact argument I used with a family member once when they were saying like, oh, well, he'll get penile cancer. And I said something like, well, my daughter has a greater chance of getting breast cancer, so should I remove her breast now? I think she was like 2 at the time. And they didn't really have a response to that.
No, all of these justifications, I mean, this is what people do when, not all people, some people will stop and say, oh, let me think about this, right? But it's very common for people to look for defenses that they've really never even used in the past and they don't know anything about, right? Because it's threatening to hear, especially if you've cut your child, right?
Mm-hmm.
Or if you've cut a child, doctors, right? Or if you've persuaded, if you've lied to parents so that they'll cut their children. I mean, you know it hurts and you told them it doesn't hurt, right? Mm-hmm. So it's a natural thing for people who are complicit in some way to put up these excuses and these defenses. And they're all ridiculous, really, right? Yeah. They're all, none of them make any sense. It doesn't make sense to remove a normal, healthy, protective, pleasurable body part. Doesn't make any sense to remove it. And to remove it from somebody else who cannot understand what it means, cannot give consent, is a travesty.
Mm-hmm. And we know so much more about like childhood trauma now, right, and how it impacts you for the rest of your life. I can't help but wonder like how traumatic it is for babies.
We have on our website, on the intactamerica.org website, we have a section on adverse childhood experiences. And Dan Bollinger, who's an Intact America board member and volunteer, and I have written a paper about circumcision as an adverse childhood experience, lobbying essentially for that to be added, for genital cutting to be added to the inventory of ACEs, of adverse childhood experiences. There's just no way that it doesn't qualify, right? But that is still, far, far from happening. It's right. Considered. And why is this considered controversial? It's when it's so obvious. But the reason it is because the status quo is extremely powerful. And then if you combine that with the medical industrial complex and the compulsion to do medical procedures and charge for them that our country's medical industry has, all of these things coalesce. And you're essentially the young man who's doing the story for Intact America's Voices column used the word predation. He said, the medical system preys on men with foreskins. And I had said in the past, it's like the foreskin has a barcode on it. And, if you could just grab that foreskin and take it, that there's a claim that can go into the insurance company or to Medicaid. Mm-hmm. And everybody's complicit, the hospital, the doctors, the nurses who help to solicit.
Mm-hmm. As a lactation consultant, I see that babies shut down after they're anywhere from 4 to 12 hours. They're just, they're not going to eat. They're just shut down. They just want to sleep. And the parents at my facility are told it's because of the Tylenol. They give them Tylenol before they do the circumcision. And they tell them it's the Tylenol that makes them super sleepy. But really, it's just that they went through this really traumatic procedure. They just kind of like shut down because they're only 1, 2, 3 days old. And you're putting them through this very painful, unnecessary surgery. Right. And sometimes, if a family is struggling with breastfeeding, I'll try to nudge them to slowly at least delay the circumcision if they're completely set on having it. Like, don't do it now when your baby's already struggling, because it's not going to help anything at all, because those babies just shut down and then we can't work on breastfeeding at all.
So interesting, because there's so many contradictions that people don't see. They ignore, right? So it's harmless, but don't do it on a baby that's not medically stable. Well, if it's harmless and if they really don't feel a thing and it's not traumatic and it won't interfere with their breastfeeding, then why do we put that caveat in there? The baby has to be medically stable. You don't do it on little preemies. Well, why? If it's nothing, if it's beneficial, right? If they just sleep through it, why wouldn't you do it on a preemie? Now, I'm not advocating to do it on a preemie. What I'm saying is how contradictory that is. Right. That you would be protecting a medically fragile child from circumcision, but promoting it as a completely harmless, routine, painless procedure with no negative consequences. The other thing we really haven't talked about much is the complications. And the complications are far more common than parents are led to believe. And the American Academy of Pediatrics, in its now expired circumcision statement, has a sentence that says the risks are less than the benefits, although complications have never been systematically studied. Well, how can you make a statement, which is untrue, that on its face, that the risks are less than the benefits, since there are no benefits? But then to admit that there's never been a systematic study of complications, and there are short-term complications like the ones you're talking about, right? Mm-hmm. Failure at breastfeeding, bleeding, infection, pain.
And those babies are short-term. Die. I don't think that's talked about enough.
And babies die
from circumcision. I remember when this was like years and years ago, but the whole controversy over hot dogs, giving children hot dogs, came out. And that's when they started telling parents, you have to cut the hot dogs in half and across, because a certain number of young babies had died eating hot dogs. And I remember looking at that and thinking, but more babies die a year from circumcision, and nobody's talking about that.
Right. And the reasons given, when a baby dies from circumcision, and it's from circumcision, and I know it's from circumcision, because he bled to death, or went into shock, or had cardiac arrest, or had a massive infection, a massive herpes infection, whatever. The reasons given, for example, on the death certificate are exsanguination, bleeding to death. Well, why does a newborn baby bleed to death? A newborn baby doesn't just spontaneously develop an open wound that bleeds to death, Mm-hmm. So circumcision is not listed as the cause of death. And then parents, or if the baby had a bleeding disorder, but you're circumcising a newborn, you have no idea that baby had a bleeding disorder. I don't know when tests are done I've heard, I don't know if you want to put this in, that one reason that Judaism calls for circumcision later, the 8th day, there are various theories, but one is that it takes a few days for the babies to be able to coagulate better.
Yeah, the vitamin K built up more.
Okay.
And yes, that's true. Yeah.
So you know more than I do about that, and thank you for that. Right. So circumcising a 1-day-old baby. One of the most heartbreaking anecdotes I heard from a young man who had a tremendous sexual dysfunction and a malformed penis from a circumcision in his early 20s. And he wrote a letter to a pediatric urologist. He said, I was circumcised when I was 7 hours old. And, you're imagining this tiny baby, right? I mean, 7 hours is sort of what it takes for a hospital to, bathe the baby, put his little wristband on. I mean, 7 hours is nothing. This child is barely of the non-womb world. Mm. And that somebody would cut off part of its body. It's just like the most heartbreaking statement. And then he's an example of permanent, devastating complications. You're operating on this little tiny. People say, look, circumcision is tiny flap of skin. Well, everything's tiny on a baby. His pinky is super tiny. So you're going to cut it off because it's little. His heart is tiny, like everything. And so what a stupid and then that's projected forward. If you cut off this tiny little piece of skin on this newborn baby, even though you have to rip it away from the head of his penis, and then you're saying it was just a tiny piece of skin. Well, think about the size of a grown man's penis, and the foreskin is a prominent organ. It varies in size, just like all of our body parts vary in size from person to person. But a foreskin unfurled in an adult, and it's a double layer, can be 12 square inches of skin, 12 to 15 square inches of highly erogenous, nerve-laden, blood vessel-laden skin, thousands of nerve endings. I mean, that's why it's there, right?
Right. It's like a flap of skin, but it has a purpose. It's not like a hangnail or something.
And it's also right. And it's also a unique flap of skin, a unique organ, much like, you could say, the lips are just skin. Well, the eyelids are just skin. No, they're highly specialized and functional. The lips, like the penile foreskin, it keeps the inside of your mouth moist. It's a lubricating, they enhance lubrication. The foreskin enhances lubrication for intercourse. The gliding action makes intercourse more pleasurable for both the man and his partner. The foreskin has certain something called Meissner's corpuscles, certain nerve endings that are completely ablated with the removal of the foreskin. The frenulum, which keeps the foreskin from just flopping around in an adult man, the frenulum is highly erogenous, highly sensitive. And in some circumcisions, the doctors dig it out, so there's nothing left. And others, they leave it, and it can either be a source of sensitivity and pleasure, or it can be a source of agony, depending on, what else is exposed. And then the circumcision also, as you know, exposes the glans penis, the head of the penis, which is meant to be an internal organ. It would be like, again, if you remove your lips, the inside of your mouth is going to dry up. And I guess, you can use, lubricating mouthwash, but the inside of your mouth is going to dry up. The glans penis becomes another color in a circumcised man. The glans penis is pink or red in an intact man, and more gray because it's become, rubbed by underwear, exposed to the outside world. And that's not how it was intended. If you're a pet lover, if you have a male dog, male dogs have foreskins completely covering the rest of their penis, and that's for protection. And the penis emerges when the rest of the penis emerges, when the dog becomes sexually stimulated. And that is true in a human male. With erection, the foreskin slides back, and that's how a man is primed for sexual pleasure. And then when he becomes flaccid again, the foreskin will recover the head of the penis and protect it. And all of those things, no urologist trying to get a 18-year-old or a 20-year-old to have a circumcision is ever going to tell him those things. He'll just say, "Oh, it's no big deal. He won't notice."
And we had something in our family, which I won't go into much detail about to protect my son's privacy, where circumcision was being recommended. I think he was maybe 12 or 13 at the time, to address an issue that had nothing to do with the foreskin or anything like that. And thankfully, my husband, who was born in Colombia, so his culture is not circumcised, was like, yeah, whatever, that doctor doesn't know what he's talking about.
And was that child spared?
Yeah. Because my husband was like, no, we're not doing this.
Wow. Yeah.
But I wonder if my husband had not been from a culture that did not routinely circumcise.
Well, you tend, because circumcision is so normal, which of course we know a lot of things we consider normal aren't normal, right? Are not okay. Just because something is common doesn't mean it's beneficial. Because it is, and because you're vulnerable always when you go to a physician, right? I mean, there's a power relationship there that's very common. And this person speaks with this voice of authority, and you think, well, why would he be saying that? Why would he or she be saying that if it wasn't true? And we also don't want to believe that doctors are just trying to make money off of us. We kind of know globally that doctors try to make money. They have to make money, of course. We all have to make a living. But to translate that into this intimate relationship where this person has your health and hopefully your well-being in their hands, you don't really want to be that skeptical. This man who I was talking about earlier, who said that this doctor convinced him to have a circumcision before he went off to college, was the same doctor who did the circumcision. So, there, and an adult circumcision, I mean, there's a few $100 on the table. And if he can do college physicals and convince intact men to do that, I mean, it's sickening, really, when you think of somebody lying in order to perform a surgery. And I know there'll be people listening to us who will say, that's not fair, but I worked in the healthcare system. I still work in the healthcare system. I ran a Medicaid health plan for 25 years. And, we saw a lot of medically dubious procedures being performed. And sometimes at the parents' request, because they thought it was beneficial, right? I mean, we're kind of don't talk about it so much anymore, but, antibiotics for viruses, people wanted antibiotics. A child had a sore throat. They didn't want to hear that there was no bacterial infection. And that's not kind of the issue of the day, but 25, 30 years ago, very much the issue of the day. Don't overprescribe antibiotics. And we'd been trained to think that everything needed a pill.
Right. Kind of changing topic a little bit back to like reasons why parents would circumcise their baby and how ridiculous some of them are. I think the one that makes me roll my eyes the most is, well, the father is circumcised and they want the baby to look like the father. And I never quite understood that one, because as having girls first, I was like, is this something where, the father takes his son on a camping trip and then they both like whip out their penis and say, see, we both look alike. So I guess we're related or something. It just never made sense to me to cut off a piece of your baby's skin just so that your genitals look similar.
Which of course they don't, right?
Right.
What about the hair?
Yeah.
What about the testicles of a baby or a young child as opposed to the hairy testicles of his father? What about size? I mean, doesn't it make more sense to inject dye into your child's eyes so they'll have the same color eyes that you do? Because everybody sees that. Nobody sees the penises, right? So it's clearly an absurd argument. However, I think it runs pretty deep, because I think that it's a roundabout way of justifying, of saying, well, there's nothing wrong with the father, because I've also talked to women who have said that their husbands were, absolutely furious about the idea of not circumcising their child. And I've said, you might want to think about the fact that he thinks you're telling him there's something wrong with his penis. And so saying, well, you're the man and you have the penis, and if you want your son to look like you, is a kind of backdoor way of saying, I think you're fine. I think you're okay. Please don't feel bad.
I can see that.
Yeah. And so I often, hardly have any credentials as a marriage counselor, as a relationship counselor, but I have talked to a number of women who were just so angry at their husbands for failing to want to protect the sons, but the guy is going through his own trauma. Probably the first time in his life. He's like having to think about the fact that this was done to him. So that plays into both the look like the father, the other look like the father thing is, if you want to think about it, well, when did that change? Because throughout human history, men kept their foreskins. So who was the first one that came up with that? Because if you really want to, keep your boy intact, and then your grandchildren will look like their fathers. Right. If my son has a son and keeps him intact, he'll look like his father, right? So, there are so many things. I mean, that would you, if the father lost a finger in an accident or lost an arm in an accident, which you cut off your baby's arm.
Right.
And of course, what you're going to hear is, oh, that's ridiculous. Well, yeah, it is. And so is cutting off part of his penis ridiculous. So that he'll look like another amputee. Or it's going to, circumcision is an amputation. So do you think that we should do, we should carve up our children to look like the accident that befell their parents? If a girl, if a mother has a breast removed, do we then go and, because she had cancer, do we go and remove the breast of her daughter so she'll look like her mother?
And
you know all these arguments. I mean, why do you get them? And why do I get them? And it's so hard to make this change, but it is changing, and it's changing thanks to people like you. It's changing thanks to organizations like Intact America and all the people who speak out. And it's changing because there are doctors who understand and who are enlightened, and there are nurses who understand, but it's just still far too prevalent, and we have to keep talking. And
progress is so slow.
Yeah, it is. But the social media has also been, people criticize social media. It's also a massive opportunity to reach out. I mean, we have a newsletter that's monthly, and your folks can go to intactamerica.org and sign up for our newsletter. It's got great information, current information, stories, advice, news items. Our website has all of that and more. There's a section called Our Positions, very brief and concise statements about the various arguments given for circumcision and our arguments for keeping people intact. Our Facebook page is very lively, Intact America on Facebook. We have another page called Circumcision Debate, and that's something you might want to refer some of your clients who are not sure what they want to do, and they find the intactivist argument too in their face. Intactamerica.org is for people who kind of have already come along a certain way, but Circumcision Debate on Facebook and on online, circumcisiondebate.org, website, has, some of the common, I'm afraid he won't look like his father, I'm afraid I won't be able to keep him clean, those things that people have been taught to fear. And we address those on that page.
And at Circumcision Debate.
Circumcisiondebate.org and Circumcision Debate on Facebook. And then our main website, intactamerica.org.
Okay. And I'll put all of these links in the show notes as
awesome.
well.
That would be great.
What is one thing that you'd want parents to know about circumcision when they have a baby? Like, if you could only say one thing to them, what would you say?
Your baby doesn't want to be circumcised. Your baby doesn't need to be circumcised. It's going to hurt your baby now, and it's going to permanently damage his sexual future. At its best.
That's with no complications.
That's with no complications, right? At its best, it will limit his sexual pleasure forever. And immediately, it will cause him, just having come out of a peaceful womb into a tough world, it will cause him immediate pain and suffering. And it will cause you a lot of trouble. Who wants to be doing wound care on a newborn? You got to get used to having this baby at home. You've got to take care of yourself after a delivery, whether vaginal or cesarean. You've got to get your sleep. Baby's got to get sleep. Your family has to be integrated in a different way, a new person in the household, all of these things. Why would you want to add into that wound care? Bandages, Vaseline, possibly an infection, blood in the diaper, worried about the feces getting into the wound. It's absurd, right?
Right.
So your baby doesn't need to be circumcised. You can protect your baby. You're the protector of that baby. So I told you a lot of things. You said one thing.
But I think it's important for parents to hear that.
You're the baby. Who's going to protect your baby if not you? Right? That's you're there to protect your baby. Your baby can't protect himself.
Right.
And to cut off his body part is not protecting it. You keep him intact, and then, over his lifetime, he can learn to protect himself. But when he's vulnerable, that's your job.
Mm-hmm. I agree 100%. Well, thank you so much for coming on and talking to us about this topic, because I feel like there's still a ways to go before we kind of make a lot of progress in this area.
Right. Well, thank you. And, if you would like to do a program in the future on the forcible retraction issue, because I think it's huge. Okay. And I think, that and it goes throughout an intact male's lifetime, actually, but certainly during the vulnerable years, toddlers, elementary school. I mean, a lot of doctors think boys should be able to retract by the age of something 2, something 4, something 7. The average age of spontaneous foreskin retraction is around 10 or 11 years old. Mm-hmm. And many boys don't retract naturally until later. And I've realized, and you're hearing, that this is a risk factor for intact boys. Keeping your baby intact is great, but your job's not done. You still, as you said, you have to fight off, the doctors, and we have to, every time this happens, a parent needs to speak out and give that doctor material. I'll send you a link to that. Okay. There's an AAP brochure on it. So maybe if you want to do another show, I'd be happy to speak on it, or I'd be happy to suggest other people.
Great. I think that sounds like a good idea.
Yeah. Right. Yeah. Well, thank you so much, Shelly. I really appreciate the time.
Mm-hmm. Have a great day.
You too.